Hi there and welcome back. This is the next in our series of videos on direct hypnosis. I'm sure from the last video you'll remember that we used a very simple eye-opening and eye-closing technique to facilitate the state of hypnosis quickly and easily. I'm going to use the same technique again this time. However, I'm going to take it one stage further. And if you remember from our very first video, I talked about how doctors and dentists use hypnosis, especially direct hypnosis, for pain relief, removal of pain and anaesthesia. I'm going to do that today, and I'm going to use this safety pin here I've got in my hand. I'm going to facilitate a state of analgesia in the back of Pauline's right hand by directly suggesting it. I'm then going to undo the safety pin, take a pinch of flesh, put the safety pin through it, close it up, and then ask Pauline to open her eyes, whereupon she'll be aware of the safety pin in the back of her hand, but she'll feel no pain or discomfort. Then I'm going to ask her to close her eyes again, take her back into a deeper state of hypnosis, remove the safety pin, ask her to open her eyes, come back into the room, and that's our short demonstration finished. Okay, so for the moment I'm just going to do what I did before, or a variation of what I did before, and ask Pauline to open and close her eyes a few times, ask her to take herself into a deep state of hypnosis, and then when I've done that and I'm ready to go, you'll find that the camera will zoom in onto the safety pin and you'll be able to see quite clearly what's happening. Okay. Hi Pauline.
Hi.
Okay. What I'd like to do is, again, if you follow exactly what I do and what I say, we'll get the results that we want. Are you okay with that?
Yeah.
So, as you know from the last time, we facilitated hypnosis very quickly, very easily, just by you following my hand and my finger and opening and closing your eyes. Yeah?
Yeah.
So we'll make it even quicker and even easier this time, because now we know how to do it. It's so much easier to do the next time. So we'll just make this process as quick and as easy as we need to. Okay, so what I'd like you to do is just close your eyes for me, and then open your eyes. Close your eyes, feeling sleepy and tired, open your eyes. Close your eyes again, feeling much more sleepy and tired, eyelids getting really heavy, open your eyes, finding it difficult, more and more difficult to open your eyes. Close your eyes, finding it really difficult to open, try very hard for me to open your eyes. Open your eyes for me please, that's it. Close them one more time, just allow yourself to drift all the way down, deep, deep down, into a wonderful, pleasant, calm, relaxed state of hypnosis. That's it, just drifting deeper and deeper and deeper. And once again, if it's okay with you, if it's not, shake your head. If it is, I'll assume it's okay. I'm just going to take your right hand, lift it in the air, and let it drop. And when it drops, I want you to allow yourself to go nice and deeply, very deeply in fact, into hypnosis. Just want you to do that now. Okay, just lifting that hand, just bending it at the elbow, that's it. I'm just going to drop it, and when I drop it, when it reaches any part of your body, you can just allow yourself to just drop into a very deep, peaceful, comfortable state of hypnosis. Just dropping it now. That's it, naturally. Just drifting all the way down, really deep. What I'm going to do now is, I'm going to suggest to Pauline, very clearly and very directly, that she can start to remove any normal sensation or feeling in her right hand, in the back of her right hand, so that her right hand becomes numb, as if a local anaesthetic has been injected into the back of the hand. So I'm going to do that now. Okay, Pauline, I want you to use the power of your mind very clearly, very directly, and just imagine for me that your right hand is becoming completely numb. All normal sensation and feeling is leaving your right hand as I speak and as you listen. It's happening now, it's happening quickly, and it's happening easily. That right hand is becoming more and more numb. That right hand is becoming more and more numb, all normal sensation and feeling leaving that right hand. I'm just going to count down from 3 to 1. By the time I reach the count of 1, I want that right hand to be completely and utterly numb. Just as if that hand didn't exist at all, as if it wasn't there. And that's 3, 2, and 1. Right hand completely numb. That's good. What I'm going to do now is I'm going to take this safety pin here. I'm going to open it so that you can see it there. And I'm just going to move across, take a pinch of the skin on Pauline's right hand, insert the safety pin through the skin, close the safety pin, and then ask Pauline to open her eyes, come out of hypnosis, but to leave the hand completely numb. So I'm just going to do that now. The camera will probably zoom in on this now so you can see it clearly. I'm going to take a pinch of skin here, hand completely numb, perfectly numb. Taking the safety pin, that's it. And just just now, pushing it through. That's right. Pushing it through the skin. Problem is that the safety pin, it's actually quite blunt and it doesn't seem to want to go through here. We'll just try a little bit further. I'm completely numb, really numb. That's it. That's it. Okay. I'm not getting the safety pin all the way through because it seems to be a bit blunt, but I'm sure you can see there. That safety pin is quite firmly in the back of the hand there. There's no difference in the sensation on Pauline's face. You can just see it poking through the skin there. We won't take it any further than that. We'll just leave it where it is there. As you can see, this is not faked in any way whatsoever. That safety pin's real. It's in the back of the hand. Any normal person who is in a waking state would be feeling pain, would be feeling discomfort at the very least. Probably complaining quite severely that there was a problem with the back of the hand. So we're going to leave that hand exactly as it is, that safety pin sticking out of the back of the hand. I'm going to ask Pauline in a few moments, when I count up to 3, to come out of hypnosis, but to leave that right hand completely numb. To leave the right hand completely numb as she comes out of hypnosis. Okay? 1, 2, and 3. Just opening your eyes now with your hand completely numb. That's good. Excellent. What happens sometimes when people are in hypnosis, that sometimes their saliva will drip from the mouth, sometimes their nose will run, all sorts of strange phenomena happening with some people while they're in hypnosis. In this case, Pauline's nose started to run, but there's nothing wrong with that, it's perfectly normal. Now as you can see, safety pins there, hands completely numb. Okay, you okay, Pauline? Yeah. You feeling okay? Your hand okay? Yeah. Okay, so Pauline's talking to me quite clearly, quite coherently, but she's got a safety pin sticking out the back of her hand. So you can see how this technique, with a bit of practice, can be used quite easily to be able to numb a gum or to numb other parts of the body to make them basically pain-free, so we can carry out surgical procedures and other sorts of things by doing that. So what I'm going to do now is just to ask Pauline very quickly, I'm just going to count from 3 down to 1, ask her to allow herself to drift very quickly and easily into a deep, comfortable state of hypnosis. I'm going to remove the safety pin, ask her to allow her hand to come back to normal, and then ask her to open her eyes. Okay? So just going to count from 3 to 1, Pauline. I'd just like you to take yourself all the way back down to the hypnosis. So 3, 2, and 1. That's it, all the way deep. Hands still completely numb. Really good. I'm just going to move across now. Camera will zoom in here for me. I'm just going to take this out the back of the hand. Okay. The camera zooms in there. You can see there's a slight mark, but there's no blood loss, anything at all like that. That's the safety pin. Unfortunately the point was a little bit too blunt, couldn't get it all the way through the hand. Just going to close the safety pin up. It is a real safety pin. I'm just going to take it to one side. Okay, what I'd like you to do now, Pauline, is I'd like you to allow all normal sensation and feeling to return to the back of the right hand. The right hand will feel completely normal in every respect. However, there will be no pain, no discomfort, and no after effects of any sort after this short demonstration. Your hand will feel perfectly normal in every way. I'm just going to count from 1 to 5. By the time I reach the count of 5, your hand will feel completely normal, just as it did before it went numb. It'll be completely normal in all respects. So 1, 2, 3, normal sensation and feeling flooding back into that hand now. 4, hand starting to feel absolutely normal, just the same as your other hand. And 5, your right hand absolutely normal. When your right hand becomes absolutely normal, you can just open your eyes, come out of hypnosis. That's good. Okay? How do you feel?
Fine.
Is your hand okay?
Yeah.
Excellent.
I can hardly see the mark.
Okay. That's the use of direct hypnosis for analgesia or pain relief. Thanks for watching, and we'll see you on the next video.